I'm feeling a bit crap. I've done my nebulizer, and then I decided to do some mucus clearance, which is just sort of breathing out but giving yourself a bit of a wheeze, if that makes sense. So your main priority is to cause some rattling in your chest, and that rattling will be the mucus that needs to come out. Now, I did a video a while ago, and I don't know if I've set it to private when I had a break, or it's on the YouTube. But if it's not, I'm gonna have to, put it back to the public, because a lot of people did get some good results doing this mucus clearance, and exercise alone will not bring up as much mucus as this exercise, because it's particular on the lungs. So riding a bike, you might have a cough here and there. If you're riding a bike in a gym or you're on a treadmill, you'll eventually get the lungs moving, so you'll cough and then you'll bring some mucus out. But the technique I'm about to show you, I learnt this in Withenshaw Hospital, and the reason I got taught it is because she asked me at the time what mucus therapy, physiotherapy have I ever done. So I told her briefly that when I can exercise, I exercise, and when I can get rid of it, when I do nebulizer, I do, I try to cough as well, bring it up. She said they're not too bad, but there's advancements in clearing mucus out of the lungs. So a lot of people in America, they have the option of buying a vibrating vest. So they're not cheap. I'm hearing about £10,000. We don't have them here as such. I don't know if they have since years ago. I don't know. I don't know if some hospitals loan them out, but they're supposed to be really good. It's obviously just like causing that vibration around the body, which is causing the effect of, if you remember being in a pram, if you remember, if you have that good memory, a pram, and going across some cobblestones, and you make that noise. So by doing that, it's shaking everything up that needs to come up, and then obviously, or hopefully, you will then bring the phlegm out and get rid of it. So this is what we're going to work on now. I should have done this before I actually done the clearance, because you could have seen how much I was clearing out my lungs just doing this method. No, I'm not from the United States. No. I know a lot of people in America who have bronchiectasis. They have the facilities of, stuff we don't have here. So because people in the UK only have nebulizers, IV treatment, and they don't do physiotherapy on the lungs like they used to. You get admitted in the hospital, a physiotherapist just comes to see you, just to speak to you, ask you things like what brought you in to hospital in the first place. So you might start saying, well, I've got a history of lung disease. I was doing my home nebulizers. I was taking rescue packs, taking the steroids for my chest, and I wasn't getting any better. My oxygen sats dropped, my heart rate went higher. So I knew that I couldn't look after myself at home. I needed to go in hospital. So the physiotherapist will say, okay, how are you managing stairs? That kind of thing. Have you got anybody at home to look after you? If we discharge you. But they won't discharge you in the hospital if you're a lung patient if your oxygen sats are below 96. They have to come up to at least 96. Then they want to know that they're sending you home and you're able to bring that mucus up that's trapped. Because if you don't, you run the risk of, suffocating in your own mucus, and, that's not good. So the basic exercise I'm going to show you is it's pretty easy now. Everyone has their own pain thresholds when it comes to this. So I wouldn't recommend doing it if you've got a full-blown infection and you've got, pleuritic chest pains around the front or the back or anything like that. I'd say proceed with caution. But it is a great exercise in removing mucus that you don't even know is in there, because we can't see it. Sometimes we can hear the wheeze, whether it's on the right, the left. But I'm just going to show you anyway, because I think people don't know about this, which is quite sad. You know, they get sent a nebulizer and say, okay, use the salt, it's good for getting rid of mucus, but they don't tell them about this in particular exercise. So I'm going to shut up a minute because I'm going to show you. So the idea is to breathe in through the nose and then hold that air pocket in the lungs and then slowly release it. Just do that. And you can repeat that for about 5 to 10 times. And you can do that sitting up. So it's not very strenuous, this what I'm showing you. And then you can lie on your side and repeat that exercise to the next step, which is the huffing that's going to bring the stuff up. Obviously, I'm not going to show it out my mouth, but you can hear the chest rattling. So we do exactly the same what I've just done. So in through the nose. And I'll get rid of that. So that exercise right there could save someone's life. A simple exercise like that could save someone's life. And a GP wouldn't even know. You could go and see your GP and they wouldn't even know to tell you that exercise. What they would do, they would give you some antibiotics. And though antibiotics treat infections, they don't ultimately destroy them or keep them at bay. The whole purpose of an antibiotic is to starve the infection of what it needs to survive. But it's also very important that you are doing everything possibly to, stop this situation reoccurring. So by doing the mucus clearance in the chest, it's minimizing build up. So if you can minimize the build up, you also minimize the risk of constant infections. And as the lungs get damaged more, I was telling this my mother, you got to remember, imagine a road that's got loads of little potholes and then it gets filled with water. And this is what a doctor showed me many years ago. So the lungs are very like the bronchial trees with branches and things like that. And after so many infections, the lungs start getting damaged. And when they get damaged, they get scar tissue, which then leaves, holes like you would see in a road. And then what happens is then the holes get filled with mucus. And then because we're not getting rid of that mucus, it's building up. And then we can run into all sorts of stuff, guys. We could need a chest drain to drain the mucus. We could get full-blown pneumonia. And when you do get full-blown pneumonia, you're going to be very, very weak. And then breathing exercises I've just shown you, they're going to be very difficult to perform. Are you going to have the energy to perform them? By then, is it too late to perform that exercise? So prevention is better than cure. So that stuck with me when my doctor told me that. Sorry not to do. I use the flutter and I don't find any benefit with a flutter. And I'll tell you why. Is it's like a pipe. It's like a pipe with the ball bearings in, like a ball bearing. And you blow and you hear that rattling. Now, for me, it would be better if something was rattling in your chest, like I've just shown you, that causes that rattle. And I think by putting a flutter in your mouth, you're restricting, in my opinion, you're restricting the amount of air that you can bring out, if you know what I mean. So I don't think they're good. I can also give you the opinion of someone else who's used one. They say they cause more chest pain. They seem to cause a lot of chest pain, and you can't use a flutter if you've had a collapsed lung. I had a collapsed lung when I was a child, and the moderator on the channel also had a collapsed lung at some point in her life. So, yeah, I just think the flutter was designed, yeah, and I'll be honest with you, to reduce physiotherapy in chest. So instead of doing all that, you used to do the clapping on the back, like, and then go round. My mother used to do this to me before I was diagnosed with bronchiectasis, because I was a very, very poorly child with temperature and things like that. And she did it. So somewhere in her country back then, this is something they performed with, the family members if they had build up of mucus, colds, flus, and it's something that they did use even in in the NHS at some point. But then, like anything, they start saying, "Oh no, that's what they used to do years ago. It's not effective." What they try and do is something that's less cost effective, such as a flutter. So I don't know how much it costs to make a flutter. I wouldn't imagine it takes as much as, one-to-one sessions with a person who needs physiotherapy for an hour long. So yeah, the wages they've got to pay the nurse compared to giving you a flutter over in the UK. So I just think it's all about keeping the numbers down. Um, the same way with the IV therapy now, that's absolutely disgusting in the UK. It's like specialists are arguing with microbiologists, and it's like I do believe that a lot of people with this new system, let's call it a new system, with that now being brought in, I do think people are going to lose a lot of we're going to lose a lot of people, um, because it's specific for people like us who have shown a history of up and down, up and down, up and down, never fully well, always showing bouts of infections, 2 to 3 months, maybe in a 3 month period they've had 2 infections. That's where I'm at sometimes. So yeah, just going going off science. This is what they're trying to tell us. Going off science, but the science isn't there. So the argument is the science isn't there to keep the IVs going, and the science isn't there to stop the IV antibiotics. So what they're doing, I've said it before, don't want to be a parrot, they're playing Russian roulette with people's health, because if they start withdrawing this medication, we're going to start seeing the suppressed bugs in people's chest, the pseudomonas showing back up, the colonizations of Haemophilus influenza, more colonizations. So when you think about colonizations to antibiotic resistance, what they keep banging on about, I would rather have whatever life I've got left than have colonizations of many bugs. I've had no luck with respiratory or physio. Yeah, explain more. I mean, uh, I don't know. I don't understand why there isn't many physiotherapist rooms regarding the chest. I know obviously there is for certain things, like obviously pelvic floor exercises, things like that. If you damage your bone, you then go into like into a physiotherapy therapist, or you see someone, you get the joints moving again. But there's nothing like that regarding the chest. So knowledge is power. And because I've had so many hospital admissions, stays, I've learnt things along the way. So I tried to put it out there to you guys that, just because you're not generally looking unwell or anything, just be mindful about how long you have gone without bringing much mucus up. Okay, so it's like my mother. She says, "Oh, I'm bringing it up. I'm okay. I'm bringing it up." But I'm saying if you just use the nebulizer for once, twice a week, instead of just saying I'm bringing it up, you would see how much your life, your life. What's the word for it? Not expectancy. Life improves. Just anything. Just what you're able to do, what you're able not to do. So bear that in mind, guys. I'm gonna shoot. Thanks for anyone who come along, and see you on the next one.